Yes, hi, this is Dr. Khan. So I've just completed 100% total capsulectomy on the right and also on the left. Nice lady. She's young, in her 40s, early 40s, from Texas. And she had a grade 4 contracture on the right and a grade 4 contracture, capsular contracture, which means that she had what was a painful, palpable, visible, irregular, asymmetric contour on the right side where the implant literally had migrated up. Which is what the contracture does. It basically, the capsule solidifies, hardens around the implant and like squeezes it hard, like a contracture. Like someone's having contractions during birth, for example, it contracts and squeezes hard against the implant and causes pain. As you can imagine, the many delicate sensitive nerves around the chest and breast nipple area. So as you will see, the right side was a challenge. It took almost over 2 hours for me to do the right side. And the left side, you can see, first of all, look at the conformity. This is nice and round on the left side with the L. And on the right side, you can see how spread out it is. Now, this is, as you can see, all the way around, everything is good, except for this one area where you can see there's a small hole. And I used one of these Raytex sponges in order to plug in as I was dissecting. Now this was a very tedious dissection because I dissected complete removal of the entire implant capsule such that none of this spilled into the chest. And wherever this small hole was, this was directly on the hardest part of the case. I was able to plug it and then continue on with my dissection. It took twice as long on the right side than on the left. And as you will see, I'm going to go ahead and cut this side open now that I've touched this, and I'm going to go in from there. As you can see, clearly it's ruptured, and you can see like the fascia of the muscle is right here. This is how thin, and you can see, look how thin the capsule is. So it doesn't take much to cut into it. Now this was very much tethered onto the rib, and that's why you basically had this inevitable break. And as you can see, as I cut open, all of this was contained. Now this was in 2009 when the implants were reintroduced into the market, supposed to be safe. And I'll tell you, there is nothing safe about this implant. It's been ruptured for a while, causing this patient a lot of misery. None of this spilled into the chest. It was done in 100% total capsulectomy. And look, the implant is literally disintegrated. It has that gummy bear consistency to it, but what good does it do when it is ruptured? And you can see everything is contained. The capsule is so thin that you can actually see and read right through it right here. You can see, look at the numbers. And this is where the whole care and sophistication in regards to dissecting such that none of this spills into the chest, because the moment it does, like slime, no one's going to be able to clean it, wash it, no matter how long you have the drains in for. This is not going to be contained. And look at the way how it literally disintegrated. This is not at all healthy, safe. They introduced these implants as safe after the ban from 1992 to 2007. Look, they have the same set of problems. So what I'm going to do is I'm going to remove my top pair of gloves, and then I'm going to go over to the left side. There is no such thing as safe implants. That's just like saying there is no such thing as safe cigarettes. All of them cause badness. And same thing likewise. You can see I cut out the scar, I cut out the excess skin. And as you will see as I dissect, very, very thin capsule. Now this implant is totally different compared to the other side. Now I'm very happy and content with how the whole, now look at this. This is, the take-home message. It looks good. People will say that's nice, but look at this. See this right here? The same stickiness you're seeing here. Look at that. It's all over me. And this is, imagine, once it goes onto the chest, it's going to be, see, the same stickiness that you're seeing right here. It's to a lesser extent here on the left side, but the same badness to a lesser extent. And this alone is enough to spread into the rest of the body and cause havoc. A lot more on the right side since it was ruptured, but certainly more so on the left as well over a period of time. And this is where you see the gel bleed. That's the term, gel bleed is occurring. And again, a capsule that's super thin, and I'm very happy and content. Look at the right next to it is that fatty tissue. I removed that because that's also inflamed. Now this is your 550 Allergan, just like the patient stated. So the bottom line here is the implants are not safe. All of that badness needs to be contained such that none of it spills into the chest. There is no need for drains. She actually recoiled very well given her young age. Very likely she will not need a lift, and you know, this is where number one, the implants are not meant to be in the body forever. They ruptured this set of implants. This is her second set. Her first set was removed, and she had the second one in 2009 under the muscle, and so this is just 14-year-old set of implants. As you can see, those implants that were introduced in 2007, 8, 9, after they were deemed appropriate and safe, these ladies are now coming in the masses because their 10-15-year mark is up and the rupture rate is starting to go up. And you will see the many ladies who got the implants in 8, 9, 10, you know, are now starting to come, and there is a surge, if you will, of the rate of ruptures, because the longer someone has an implant, the higher the chance for rupture. So there you have it. No implants are safe. The take-home message again, you see the rupture. If I go like this, you see how that gum, this gum sign is, where you see that stickiness. The stickiness was also present on the left side, even though we have an intact implant, simply because there is gel bleed that's occurring. There's silicone leaching into the periphery from even an intact silicone implant, and the implants are not safe no matter what. This is your gummy bear implant. This is not safe. The cultures were done for aerobic, anaerobic, and fungal. Twilight sedation, no need for drains, no need for lift. The implants will be returned to the patient. Capsules will be sent to pathology, rule out the BIA, ALCL, CD30 analysis, rule out lymphoma, rule out malignancy. And overall, I'm very happy and content with how the whole dissection went. It's roughly 11:47, and this is just my end of the first case, just removal of the implants. No matter how long it takes, my next patient has been waiting now almost 3 hours, but she understands that I'll give it 100%, such that she gets the same level of care that I offered this lady, so that everyone gets all of the implant capsule removed. And when we look back, the patients have the peace of mind that the surgery was done in the perfect manner, because that's what it deserves. This is Dr. Khan, Executive Plastic Surgeon.